Hello and welcome to another episode of Whispers from the Campfire, where the flames of our stories cast shadows on the unknown. I am your guide through the eerie and the unexplained. Tonight, we delve into 3 mental health conditions that are truly terrifying. So gather around, listen closely, and try not to lose sleep. Imagine believing that everyone around you is the same person in disguise. Intriguing, isn't it? That is exactly what those suffering with the first mental health condition known as Figoli delusions go through. The term Figoli delusion was coined in 1927, inspired by Leopoldo Figoli, an Italian actor famous for his rapid costume changes during performances. This delusion was first described by psychiatrist Corbin and Fale, who documented the case of a woman convinced that she was being pursued by actors she frequently saw in the theatre, whom she believed were disguising themselves as people she knew. Figoli delusion is a rare psychiatric disorder where an individual believes that different people are, in fact, a single person who changes appearance or is in disguise. This delusion is part of a group of misidentification syndromes, which also includes Capgras delusion, where a person believes that someone close to them has been replaced by an imposter. The Figoli delusion is classed both as a monothematic delusion, which is a delusional state that concerns only one particular topic, and as a delusional misidentification syndrome, which is the belief that the identity of a person, object, or place has somehow changed or been altered. Think of it as you're a person at a masquerade party, and one person continuously changes their mask. An exact number of sufferers is not known, but from a review of 4,656 studies, it shows that 83 of those studies reported only 119 cases. So with this condition being so rare, do psychiatrists know how it is caused? Well, it is thought to arise from several potential causes, such as neurological damage, often associated with lesions or traumatic brain injury or abnormalities in the brain, particularly in areas responsible for facial recognition and memory. Other psychiatric conditions commonly linked to schizophrenia or schizoaffective disorder or other psychotic disorders, and cognitive dysfunction, problems in the brain's ability to process and differentiate faces leading to misidentification. People suffering from Figoli delusions are truly intriguing, but what symptoms would they exhibit? They believe they are being persecuted by the person they think is changing appearance. They identify multiple individuals as the same person despite clear differences in appearance, voice, or behavior. They experience intense paranoia and suspicion, and often feeling threatened or watched. They confuse familiar people with strangers, attributing actions or behaviors to the supposed disguised individual. The impact of Figoli delusion on individuals and their loved ones could be profound. Patients may isolate themselves due to fear and paranoia, and their relationships could suffer as they struggle to trust those around them. The constant suspicion and belief in a single persecutor can lead to significant distress and impairment in daily functioning. So, is there hope for sufferers? Treatment for Figoli delusion typically involves a combination of medication and therapy. Medications such as antipsychotics are commonly prescribed to manage the delusions. People can go through cognitive behavioral therapy, which helps patients challenge and change their distorted beliefs. Supportive psychotherapy provides a safe space for patients to discuss their experiences and feelings. Addressing any underlying neurological issues is also crucial in managing the condition. Figoli delusion is a window into the complexities of the human mind and the fragile nature of our perceptions. By understanding and raising awareness of such conditions, we can foster empathy and support for those who experience these challenging realities. If that condition wasn't quite terrifying for you, we'll carry on to our next one. The next haunting condition we're going to cover is known as alien hand syndrome. Alien hand syndrome is a rare and fascinating neurological disorder characterized by a person's inability to control the movements of one hand, which seems to act on its own. This condition offers profound insights into the brain's complex mechanisms controlling voluntary movement and body awareness. Alien hand syndrome was first described in 1908 by German neuropsychiatrist Kurt Goldstein. He documented a patient who experienced involuntary hand movements following a stroke. The term alien hand was later popularized in the 1970s by neurologist Joseph Bogan during his studies of split brain patients, individuals who had undergone surgery to sever the corpus callosum, a bundle of nerve fibers connecting the two hemispheres of the brain in order to treat severe epilepsy. Alien hand syndrome is a neurological disorder where one hand acts independently of the conscious mind. This affected hand may perform seemingly purposeful actions without the person's intent, leading to a sense of disconnection from the limb. It could give people witnessing these movements a feeling of unease, as the person may in fact be completely coherent and otherwise normal in behaviour. So what is believed to cause this condition? Well, the common emerging factor is that the primary motor cortex that controls hand movement is isolated from the premotor cortex, but remains intact and able to execute its own movement of the hand. It still remains a mystery and its exact cause is unknown, but the possibility of neurological damage such as stroke, neurodegenerative diseases such as Parkinson's, tumours or aneurysms could lead to its development. There are actually several types of alien hand syndrome, classified based on the location of the brain lesion. Callosal alien hand syndrome typically results from damage to the corpus callosum. Patients may experience intermanual conflict, where one hand acts in opposition to the other. There is frontal alien hand syndrome, caused by damage to the frontal lobes. It often leads to grasping or groping movements. And posterior alien hand syndrome results from parietal or occipital lobe damage and can cause more complex movements and behaviours. People who suffer alien hand syndrome may exhibit some telltale symptoms, such as involuntary movements. The hand may grasp objects, perform tasks, or even interfere with the actions of the other hand. Lack of control. The individual feels they have no control of the actions of their affected hand. Awareness. Unlike other movement disorders, the person is fully aware of the involuntary movements and conflicting actions. The affected hand may perform actions that counter the person's intentions, such as unbuttoning a shirt that the other hand is buttoning up. As with Fragoli delusion, the impact of alien hand syndrome on individuals can be profound and multifaceted. Simple tasks can become challenging or impossible. For instance, an affected hand might undo the work of the other, as we just described. The condition can lead to significant distress, anxiety, and embarrassment. The feeling of having a part of one's body acting autonomously can be deeply unsettling. People with alien hand syndrome might avoid social situations to prevent awkward or disruptive involuntary movements. Exact number of sufferers is unknown. It can be as low as 50 cases worldwide. Without a doubt, this condition is debilitating, and those suffering may wonder if it could be treated. Well, currently, there is no cure for alien hand syndrome, but several strategies can help manage the symptoms. One can go through behavioural therapy, techniques to help regain some control over the hand, such as using the unaffected hand to restrain the alien hand or engaging a task to occupy both hands. Cognitive therapy, helping people cope with the psychological impact of the disorder through counselling and support. Alien hand syndrome remains one of the most intriguing and mysterious neurological disorders. It challenges our understanding of voluntary movement and body awareness, highlighting the brain's incredible complexity. While research continues to explore underlying mechanisms and potential treatments, individuals with alien hand syndrome rely on a combination of therapeutic strategies to manage the symptoms and maintain a quality of life. If you had lasted this long, the last condition we'll detail is known as Ekbom syndrome, also known as delusional parasitosis. Ekbom syndrome is a rare psychiatric condition in which individuals have a persistent and false belief that they are infested with parasites. This delusion can involve a variety of parasitic infestations, including insects, mites, or worms, even though no such infestation exists. Ekbom syndrome was named after Swedish neurologist Carl Axel Ekbom, who first described the condition in the 1930s. Dr. Ekbom published his findings on the syndrome, highlighting its symptoms and distinguishing it from other types of delusions. The exact cause, much like the other conditions, is not known, but may be related to excess dopamine in the brain's striatum. Through Ekbom studies and further research, it was found people exhibit a range of symptoms. Symptoms are primarily centered around the delusional belief of infestation and can include persistent itching or crawling sensations, often described as feeling insects or bugs under the skin, associated with excessive scratching, picking at the skin, and trying to remove perceived parasites. They can suffer visual hallucinations, seeing imaginary parasites on their skin or in their environment. It can lead to paranoia and anxiety, intense distress and preoccupation with the perceived infestation, leading to social withdrawal and obsessive behaviors. As you can imagine, this is a cruel and horrific syndrome to suffer from. It has a serious effect on one's life and culminate in sufferers causing physical harm, such as self-inflicted wounds leading to skin infections due to constant scratching and the use of harmful substances. They may have decline in their overall mental health, leading to increased anxiety, paranoia, and depression, resulting from the persistent delusions. They may isolate themselves, avoiding social interactions and activities due to embarrassment or fear of spreading the perceived infestation. And lastly, financial strain, spending large amounts of money on unnecessary treatments, pest control, and medical consultations. Diagnosis of Ekbom syndrome is challenging though, and involves clinical interviews, ruling out of other medical conditions, and further psychiatric evaluation. And so, is there hope for sufferers? Treating Ekbom syndrome requires a multidisciplinary approach. Someone diagnosed with Ekbom syndrome may be started on antipsychotic medications. Drugs such as risperidone or olanzapine are commonly prescribed to manage the delusions. They'll need to undergo psychotherapy, such as cognitive behavioral therapy, which can help patients recognize and challenge their delusional beliefs. They need lots of supportive care, regular follow-ups with mental health professionals, education about the condition, and support groups, and to address secondary issues, such as treating the skin lesions and infections resulting from scratching and other behaviors. However, treatment may be difficult, as sufferers may be resistant to care, as individuals with Ekbom syndrome strongly believe in their delusions and may resist psychiatric treatment. People can be misdiagnosed as having a dermatological issue rather than a psychiatric one, delaying appropriate treatment. And the further stigma involved, as mental health stigma can prevent patients from seeking help or adhering to treatment plans. Ekbom syndrome is a complex and distressing condition that requires comprehensive management to improve patients' quality of life. Understanding the syndrome's symptoms, impact, and treatment options is crucial for healthcare providers to offer effective support and care. Thank you for joining me by the campfire. If you like this video, be sure to like and subscribe to see more content. As always, keep the fire burning and the stories alive.